Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Cassie Mathis, a certified practitioner in orthotics and prosthetics and the owner of Baby Bear Clinic in Appleton, Wisconsin. Cassie's career journey was originally inspired by her niece's orthotic needs, and after extensive schooling and experience within the field, she decided to start her own clinic in 2020. Baby Bear Clinic specializes in cranial remolding helmets, braces for conditions like scoliosis and leg instability, and other custom pediatric orthotic needs. Cassie's approach integrates the latest technologies with a family-friendly feel to ensure the best care while reducing stress for families. When she's not at the clinic, Cassie enjoys running, playing pickleball, and cheering on her 3 sons at their sports games. We're excited to have her on to share how families can navigate pediatric orthotic care with confidence. Hello, welcome back to the Motherhood Alliance podcast. We are in our 4th episode with Cassie. I can't believe we're in episode 4. I feel like we could continue to learn so much from you, but we're excited to welcome you back. So today we're going to be talking about scoliosis specifically within kids, and I believe that this is something that you support pediatrics with, not adults, in this realm as well, but we're going to dive into that. So I think my first obvious question is, I think we've all heard the word scoliosis, but what actually is scoliosis?
Yeah, so scoliosis is a curvature of the spine. It really is pretty simple. Now it can be different degrees, different levels, but it's when we're seeing either an S curve, so the spine kind of curves in one direction, and then you get a compensatory curve because your body wants to stay upright, or a C curve where you're seeing more of just one-sided curve.
Okay. And what are the causes?
So 80% of scoliosis is idiopathic, meaning there's not a diagnosis or, something going on. There does seem to be a genetic component, but it's not, I don't know that's in any research studies. But it's really kind of idiopathic. It usually is associated with or around the time of growth spurts. So kind of that preteen to early teenage when kiddos are growing really quickly.
So I feel like in my head, I'm like, well, is it actions that these kids are doing? Is it lifestyle based or is it genetic based? Because, when a spine is developing and they're hitting a growth spurt, it would either be, hey, my DNA is set to shape myself like this, or is it more of lifestyle based, or even like single sport athlete based, where you're doing a same repetitious type movement that's certain muscles are pulling. I'm getting sciencey here, but like my brain is kind of like, What is causing this? So I guess what are your extended thoughts on that?
That all makes sense, but there's not anything. It really is just kind of idiopathic.
Okay.
Now, could it be like how the muscles are developing and like that type of body shape is more likely, but there's not that I know of anything really specific to like certain sports or like that you have this scoliosis gene or anything like that.
So like thinking about preventing it, there's really nothing that you can do to prevent it either then?
Not prevention, but early intervention. So when you get a scoliosis curve, there's kind of 3 slots that you fall in. So when we have curves between anywhere between like a 5 and 20 or 25 degrees, you're not doing anything. You're really just monitoring that and making sure you're going in for, the curves are diagnosed through x-ray. So there are some clinical signs that you can look for: uneven shoulder height. You'll see like a scapular projection, more of like a twisted shape. When you may have seen like the bend forward test, and you can see what like a rib hump higher. So there's kind of some clinical signs, and that's what your pediatrician or primary care physician's kind of just doing a once over. And most of the time, that's enough to kind of rule that out. But if there is something that's like, hey, that looks a little bit off, that's when you get referred to a specialist, usually an orthopedic specialist who's going to do x-rays to figure out exactly what that curve is. And then from there, determine treatment. So that 0 to 20, 25 is monitoring. 25 to 40, 45 is going to be where I come in, that bracing component. And then 45, 50 above, that is a surgical intervention at that point.
Okay, interesting. So the journey kind of looks like, I would assume a parent might even notice something first where they're like, gosh, that one shoulder is pretty frequently lower than the other one, or permanently lower than the other one. Seeing a pediatrician, that pediatrician, especially if you have concerns, bring it up with them, then they would refer to ortho. And then if they're within that range of degrees, then they would be referred to you.
Correct.
That's the path?
Mm-hmm.
Okay. What does treatment look like? Like, what are the treatment options for within your range? Is a brace really the treatment?
Yeah.
Okay.
Is chiropractic involved too in all this?
It can be. Yep. So can be. Physical therapy is another one. So there is, obviously, if there's a curve, there is typically going to be some muscle imbalance. So you can do some therapy interventions. There's some methods that are like strictly therapy interventions, and I think they are pretty effective, but they're very involved. So, it's a big time commitment. And also geographically, you have to have like the Schroth is one of the methods that's kind of more popular. You have to have like a Schroth certified physical therapist that's willing to kind of be able to walk you through that. So the bracing is an alternative to that, and can also be used in conjunction where we're really supporting that curve and preventing it from getting worse. So the brace is going to typically correct the curve in brace, but when they come out of brace, that curve is still there. That is a structural component. We may see a few degrees of improvement by being able to kind of lengthen and elongate things, or through as they grow, it's not getting worse and it's kind of lengthening. But that brace is really holding things so that it doesn't get better. So that it doesn't get worse.
Right. So is this a lifelong brace then?
No. So you're wearing the brace while you're growing. So once you've reached skeletal maturity, and that can be, you can see that through like x-rays of your hands show some of your skeletal maturity. And then also in growth plates, you can see kind of where you're at. So it's until you're skeletally mature. And then at that point, hopefully we've, prevented it from getting worse, but it's going to still be there. And there are more the higher the level, there are some long-term things. I think that's kind of almost more where chiropractic comes into play, is that long-term, keeping that balance for the long term. Because I've got a few friends who have scoliosis. One of them has a leg length discrepancy, so wearing a lift helps to alleviate back pain and things like that. I don't think she'll mind mentioning Callie actually has a low level curve, and she's like, yeah, there's like certain things where I can just kind of tell that I move differently. Pain is usually going to be more of the long-term effect of ongoing scoliosis.
Yeah. And that was one of the questions I want to ask, is how does scoliosis affect someone's life? So if we talk specifically about kiddos, if they went untreated, obviously it could continue to get worse, but is it a limitation in mobility? Does it mean that they can't play certain sports? Is there actual pain related to it? What are they experiencing?
There can be. Typically in kids, it's not holding them back. They're kind of fine. As it progresses, there can start to be some pain things. But for kids, they're so adaptable, they're just going to kind of figure out a way to do it that doesn't hurt. So it's more of those compensations that could be worrisome going on. But if they have it, wearing the brace, a scoliosis brace is a big brace. It's your full torso. It is, again, a hard thing to kind of have to come to terms with. Oftentimes it's young girls. So scoliosis is more prevalent in girls versus boys. And so that can be a huge self-conscious kind of social implication. This is one of the reasons why I'm so excited to jump into scoliosis. Currently in the area, we do not have any females that are treating scoliosis bracing. I think that comfort piece will be really reassuring to young girls. I love working with kids. I love working with parents. I love being able to kind of connect with them and problem solve through that. So that brace piece, it is a commitment. And if you're doing gymnastics, you're not wearing your brace for that gymnastics, practice or meet. So it's removable. You can take it on and off, but you're wearing it, all your school hours, you're wearing it all through the night. Again, there are different styles of braces. There are some nocturnal or nighttime braces where you're just wearing it through the night and not daytime. It's again going to depend on severity of the curve, type of curve. There's a few different components that's going to be determined typically by the orthopedic surgeon and what they're ordering, what type of brace. But a lot of them are full-time braces. So you're trying to wear it 20 plus hours a day and just removing for those times where you can't.
So, and I love how you just mentioned like gymnastics. So a lot of these kids can still participate in the activities they want to participate in. It's just if their specific sport or whatever they're doing doesn't accommodate bracing, like they need more movement than that, they would take it off for that and then put it back on for the rest of their day. Or are there any sports or limitations where it's like, if you have scoliosis and you wear a brace, you really shouldn't be doing certain things?
That's going to be more patient specific if it were more like this is causing some sort of pain. But for the most part, we really want to meet them where they're at and be able to let them continue their lives as normally and just support that. Because the other thing that can happen is I can make this really great brace that they, supports their spine, but they can't move in. And guess what? You're probably going to find that in the kid's closet and they're not wearing it. And then it's doing nothing. So again, really like finding what's going to work for them for their overall quality of life. We can meet our orthopedic goals, but if the family's not on board, if we're not working together, we're not going to have a successful treatment.
And I'm guessing this is similar to other episodes where you're having them work directly with like a physical therapist or something as well, because I would imagine that their core muscles are going to be affected by wearing this brace.
Yeah. Especially like you were mentioning with the neck brace and getting the weakness. We definitely want to make sure that we're working and addressing those things so we're not getting that muscle atrophy and we're maintaining that.
Okay. And you mentioned it can be fairly bulky. I know we were talking about 3D printing with other brace types, and hopefully they can find ways to make it less bulky in the future. But is this worn over clothes or under clothes, just so that we kind of have imagery on how this actually looks?
Yeah. So you're going to have like a tight fitting tank top, like picture like a cami or, like an under tank top underneath. And that's going to help protect the skin from any rubbing or shear forces. Then you're going to have a plastic brace around you, which is typically going to have a thin layer of foam. Some do, some don't. And then like about 3/8 of an inch of plastic. So that's, but that's all the way around. It's also got some pads in to try to correct, like the brace is working through force. You are pushing on the curve, pushing on the apex of the curve, and then you're stabilizing on the other point. So it's really working like a 3-point corrective system. So it's like, this is another thing where I don't want to act like, oh, it's no big deal. Just put on it takes getting used to, and it really takes the right mindset. Like kind of talking through that, like, why are we doing this? I can really try to coach and cheer them on, having parents on board and then trying to get that kid on board. Cause you're also getting these kids at a time where like, they're trying to be independent. They're rebelling against their parents. Like, you tell me to wear my brace all the time. Like, well, I'll show you, so really building that connection, that relationship, and trying to talk and help them through the kind of emotional aspect of that.
Yeah. And on that note, it kind of makes me think about, I know you're just getting into this space right now, but if you were able to have almost a support group or like a way that you can like connect these kids that are all in a brace so that they don't have to feel alone in this journey, I feel like that'd be really helpful for teens and even younger.
Especially girls. Yeah, for sure.
And so there are a ton, which is awesome. And we've got a link to resources. There's some really, really cool ones out there. And this is one of those places where social media and technology is great because you can connect people from all over the country and being able to share experiences. And maybe there's not another gymnast in your area who has a scoliosis brace, but maybe there is in Florida, and you can talk through things and relate and feel not so alone. So yeah, that's something that is definitely out there, and we are working to connect people to those.
Okay, so you talked about surgery. So what happens with scoliosis in surgery? Like what kind of treatment do they do in there? Yeah,
so for more severe curves where we're not able to kind of prevent it from getting worse, the treatment option is going to be a spinal fusion. Mm-hmm. So they're going in and they're correcting that curve, and they're going to get it really straight. And it's for some people like that is the best option. I'm coming from the bracing mindset and viewpoint that like anytime we can prevent surgery, I mean, there's just the natural surgical concerns. It's a big surgery, but then also like that is a long lasting thing. So they go in, they fuse the spine, and oftentimes it's a large amount of the spine. And then, that's something that throughout the years, you get wear on the top end of that fusion and the bottom end of the fusion. So typically later in life, they're going to end up having more surgeries.
Well, and I just think what are the implications, like if your spine is made to move, like every piece of your vertebrae is supposed to move. So I just think of the implications with that.
Do you feel like there's any hope for maybe bracing in the future for people that have more severe degrees, that we could, I don't know, innovate better braces that are going to be able to help support those people that they don't need surgery?
So again, we're not correcting the curve with the brace. So it's not like, we can get more correction. It's once the curve's there, it's there. We're trying to prevent it. So it's the early intervention again. We want to get to it before it gets worse. So we can keep them at a 10-degree curve or a 15-degree curve so that it doesn't get to that amount.
And they're working with a PT or chiropractor to help those muscle imbalances too, because I just imagine like having, if you have that curve in your spine, you want to have that muscle, you want to be working on that muscle structure.
Yeah.
That's where I'm at. My personal training side is just like, but like if it's curves to the right, like, can't we get the muscles on the left to kind of like strengthen and help,
Yeah. There are some braces that do, I hate to use the word market, but I think market that they get correction, but kind of the universally accepted understanding is that we're preventing it from getting worse. We're not getting a ton of correction. We're holding it. And then there are braces like in adulthood that you can wear, but again, are more for like pain management versus correction.
Yeah. Yeah, that makes sense. What about, I know that in our episodes before you talked about that you give free consults for cranial helmets. Is that something that you do for bracing as well?
For scoliosis bracing? Yeah. Mm-hmm. So we will always welcome somebody to come in for like an educational session, essentially what our consults are. For scoliosis, it's a little bit more involved because to do any sort of bracing, we do need x-rays. But we welcome people to come in and just get, a feel of the clinic, number one. Like that is one of the things that I think sets us apart is the feel of the clinic and that kind of more homey feel. It warms my heart every time somebody walks in. It's like, oh my gosh, it's so cute in here. And, it's so welcoming in here. Like when I started the business, I had the big mood board and it was like, I wanted it to feel friendly and welcoming and all of that. And I think we've done a great job encompassing that. So for scoliosis, it would be more of an educational session, but we definitely welcome that.
Yeah, for sure.
That's amazing. Are there any other specialty types of braces that you're offering as well in your clinic?
There's a few kind of fun ones. So we've done one of these, but it went great. And a custom protective face mask.
Oh.
So you might have seen these in like professional sports or professional athletes where you might have this young kiddo broke his nose twice and it was pretty bad to the point where like sinuses were getting infected and they're like, we cannot get him to this has to heal. We need to do something. And so you can go to Amazon and you can find some protective face masks, but they're all adult size.
Oh yeah.
And they're moving around. And this kiddo is in football and he's in baseball and he's in basketball. And so they're a family friend and they reached out and they're like, can you make something like this? And so we did. We made this really cool 3D printed protective face mask. It's working awesome for him. He's in basketball right now. So there is some really creative things we get to do like that as well. Another one would be pectus bracing. So this is kind of similar to the scoliosis in that we often see it in that like prepubescent or kind of right around that adolescent age when they're going through a growth spurt where you get like a prominence at the chest. So I don't know if you've ever seen this where it's almost like poking out between the ribs more often in boys. So there's a compressive brace, again, kind of along the scoliosis lines of trying to prevent it from getting worse as they're growing so rapidly. So that's something, and these are on top of mind because I just had a mom who's like, oh, you do that? What about this? And I'm like, hey, yeah, actually I can help with that too. So there are some kind of specialty things like that. And really like, if there's something we're like, can you help with that? Feel free to reach out and we'll tell you if we can or not, or who to go to that maybe can.
Yeah, no, that's really cool. I feel like that's almost
very creative.
Yeah, it's a creative side of your work but also again, coming back to like you're a custom clinic.
Yeah.
So you can like really hear what your patients need and what they're struggling with, and then to see if you can help create what they need.
Perfect. Okay. And so what are some of your favorite aspects of your work? just to wrap this up? I mean, I think everybody could kind of guess if they've listened to all 4 of these episodes, but what would you say your favorite aspect of what you do?
So relationship building,
Okay.
like I love people, I love talking, I love being able to educate them and kind of empower that. Cause I think right now, healthcare is hard. I mean, that's essentially what you guys are devoting your, entire careers to. Be like, it's hard to navigate and know what you should do and what you shouldn't do. And why is one doctor telling you one thing and then I'm telling you something else? So really, I think that is my favorite part, is to help like almost kind of just walk families through the journey. And yes, I can give you that orthotic device that might help them reach this or that goal. But I hope what they come out even more than that is like, I felt supported through that and felt like I had a choice in what we were doing. I understood why we were doing it. And that connection piece is probably my favorite.
That's awesome. And seeing the light bulbs go off, right?
Yeah.
Seeing that you're making a big difference in the world. That's awesome.
Well, and especially in our local area, because I feel like most families, if they think about needing some sort of brace or orthotic, they're probably thinking, oh, great, I have to go to Milwaukee for this.
Yeah.
Right. But
yeah, for sure.
But you're hitting Northeast Wisconsin and more. You said you pull from a 2-hour radius.
Yeah.
Or more, I would say. So thank you for doing what you're doing in our community. One more time, can you share where listeners can find you and connect with you?
Yeah. So our website is babybearclinic.com, and you're going to find kind of everything you need there. It's got tons of resources. If you're not quite ready to make that appointment, check out the website.
Thank you so much for sharing your expert knowledge with us in all 4 of these episodes, Cassie.
Thank you, guys.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.